Hi Betty, how are you today?
I'm doing well. How are you?
Good. My name is Chelsea and I'm an occupational therapist here. Do you know what occupational therapy is?
I don't.
Okay, well, it's a type of therapy that helps you get back being independent because I know you were independent in your meal preps and your self-care before your fall. And will help you engage in meaningful activities that you do every day, the things that you enjoy doing, and get you back to doing those.
Okay, that sounds good.
Okay, so I see on your chart here that you fell and fractured your humerus on your left arm.
Yeah.
So I just want to start with this pain scale of 1 to 10, with 1 being totally fine, you're not feeling any pain, with 10 feeling pain, so much pain that you need to be rushed to the ER right at this moment. So for your left arm, how is your pain feeling today?
It's probably like an 8.
Okay,
It's
so
really bad.
yeah, so that's a lot. So we'll keep you in the sling because that is doctor's orders also. So first, I'm going to check your O2 levels before we begin therapy today because I know that you do have low oxygen levels. So this is a pulse ox, which measures your oxygen levels. So I'll put it on your finger. And good, you're not wearing any nail polish. Okay, so right now you're at 88. So I would like to do this technique called pursed lip breathing, which will increase your oxygen level, and you can do these before any activities. So first you're going to relax your neck and shoulder muscles, take out all the tension, and I would like you to breathe in slowly through your nose for two counts while keeping your mouth closed. And you don't have to take a deep breath, you can take a normal breath. And then pucker or purse your lips as if you're going to whistle or blow out a candle for about 4 seconds. So can you do that about 4 to 5 times for me right now?
Sure.
And we want to get you home to see your husband because I know you like to spend time with him. So how are you feeling? Good? Okay.
Good.
Now let's check your oxygen level again to see if it increased at all. Oh wow, 98. It went up a whole 10.
Wow.
So
That's great.
it just shows that there'll be an effective thing before you do any activities. So the first thing that I would like to talk to you about today is energy conservation techniques, which is just conserving your energy as it is, so you don't have to exert so much energy when you're doing activities. So it's kind of like modifying. So I know that you have to do a lot of rest periods while doing your activities, so this will help you to take less rest periods during those activities. So the first thing I would like to go through is in the kitchen, maybe meal prep. I know you were independent beforehand. So what I would like to do today is do some mixing of ingredients. Do you like pancakes?
I do. I really like to bake.
Oh, do you? So that's good. So we're going to mix the pancake mix and the water, and we can do it with one hand. And I would like to do this sitting because when you're standing at the counter, it does exert a lot of energy without you even noticing, because maybe when you're doing it, you have to sit down frequently.
Yeah.
So when you mix things, you can sit down before you even start to cook.
Okay.
So if you would like to do that for me, here's some pancake batter and water. And you do want to keep all of your ingredients that you're going to be using all in one place so you don't have to get up and walk around to do all of that. So how do you feel doing this? Do you feel more confident cooking in the kitchen?
Yeah, definitely. I think it's a good idea to sit down. I usually always stand at the counter.
And you end up sitting.
I do get really tired.
Okay. So other techniques that we can use doesn't have to be in the kitchen. One would be in the bathroom. So for your shower, do you have a tub or do you have a stall? Or what do you have at home?
I have a walk-in shower.
Oh, good. So I would recommend for you to get a shower chair. which I actually will go get and show you, and I would recommend you get this.
Okay.
Okay, so it looks like this.
Okay.
So would you feel comfortable, do you think, using this?
Yeah, definitely.
Because instead of standing in the shower, this will also prevent from falls.
Yeah.
Like, since you fell and does get slippery in the shower, you can sit, and it does exert less energy for you.
Yeah, I would feel a lot safer in the shower sitting, especially after my fall.
Yeah, so when you're bending down to like get your legs, you can do that with sitting in the chair easier than standing and bending all the way down. Okay, so another thing that we can do is, in regards of dressing, maybe lay out your clothes the night beforehand, so you're not exerting as much energy in the morning, because people tend to be stiff in the morning. So before you go to bed, just lay out the clothes that you would like. And also, we can get you a reacher, which we have one right here. So this is a reacher, and to get on like clothes on your legs, I'll show you the technique, and then you can try it. You would put your foot in with the reacher, and then the other one, and then you would bring it all the way up to your knees without sitting, so you don't have to stand. And then at the end, you would just stand up, and then just put it around your waist.
Okay.
So you're not standing the whole time. So how do you feel with that? Do you want to try it?
Yeah, we can try it.
Okay. Okay. So here's the reacher. How's the arm feeling?
It's still a little painful.
Okay. We'll try to keep that mobilized.
Yeah.
So let's put one foot in, and then with the reacher, here we go. Pull through. Good. And then bring it all the way up to your knees.
Oh, that's pretty easy.
And then you can stand up and put it around. Yep. And if you want to get more up to the back, you would just bring your arm all the way to your back and try to pull up.
Okay.
With the one hand.
Yeah.
Okay. Let's sit back down. Okay. And the best bet for pants right now, while you're in the hospital and for a few weeks afterwards, not to wear tight pants. You can get just elastic sweatpants or elastic pants.
Yeah.
So you're not having to like button them too, because I know buttoning with one hand would be a little bit difficult.
Yeah.
So we can try using elastic pants. How do you feel about
Definitely,
that?
yeah.
You open to those? Okay.
Yeah, I think my husband's bringing some today.
Okay. Okay, so now we're going to work on some ADLs that have to do with feeding. I know that you have trouble cutting because you only have your right arm to do so. So there's an adaptive equipment such as the rocking knife, and you only have to use it with one hand. And you go like this, and see how easy that cuts it?
Yeah.
So do you want to try for me? Do cut 2 pieces for me?
Sure.
Okay. Oh, there you go. You got this. You're already a champ.
Yeah.
And I know that your husband does a lot for you, and that bothers you.
Yeah.
So with doing this, he's not going to have to put up your food. It'll just be supervision to make sure that that's getting cut, and it'll put less pressure on him. So I know that if you are able, do you feel comfortable doing the energy conservation techniques and using this adaptive equipment for eating?
I do, yeah. I think it'll definitely make me more independent and less reliant on my husband.
Good. So I'm happy that you're comfortable with these, and I'll see you next session.
Okay.